How can you successfully solve swallowing disorders with medical massage therapy? That's what we'll discuss in this short video. My name is Dr. Turchaninov. I'm founder of Science of Massage Institute located in Phoenix, Arizona. And this video we dedicate to this relatively rare but complicated issue. 82-year-old patient come to our clinic and we help him with different abnormalities, and he is a strong believer in the power of medical massage. And he came with complaint that for the last month, he slowly started to deteriorate with his swallowing. And he went to ENT doctor and everybody trying different treatment options, but still swallowing for him become more and more difficult. So he actually spent time for each swallowing. Only drinking water allows him to speed up the swallowing process, but generally speaking, even drinking water right now slow down his swallowing. And video what you see right now show his desperate attempt to swallow what he is in our clinic in massage table, and he illustrates how difficult for him this very simple act, which in reality very complex act, since it requires communication and interaction between 50 different skeletal muscles, and as well as a bunch of nerves which control their function. It also requires movement of the only one bone in our body which actually hanging in the soft tissue, which called hyoid bone. So the ideal interaction between these players in three phases, that what compose actually act of swallow. If it's one phase or even one component of the process is affected, then the entire swallowing coordination between players become greatly affected. When coordination affected, you have difficulties to have normal swallowing with all your conscious effort. So some of our patients with similar disorders also described significant change in the voice. Females, for example, start to have hoarse and more lower voice timbre, which bother them as well. Evaluation of the patient showed that he has discoordination and inability to smoothly perform muscle contraction between so-called suprahyoid and infrahyoid muscles, which main engine of the swallowing. As a result of that, the hyoid bone unable to move up and down during the swallowing process. You can feel edges of hyoid bone if you palpate your own neck and try to swallow, and you will feel the movement of the hyoid bone up and down during normal process. In his scenario, hyoid bone stuck because the soft tissue unable to pull in the correct sequence. And that what contributed greatly to his inability to swallow. And that is very debilitating for the patients because they are limited now with the food, especially with the heavy food. With food requires a lot of chewing. They stuck with the fluid food, and all of that affects quality of the life. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. So what we did, we decompress suprahyoid and infrahyoid muscles, restore their coordination, and fully restore movement of hyoid bone. When that happens, then hyoid bones start to move up and down during swallowing. And the video what you see right now is him on the table, and he counts how many swallows he can do right now without significant attempt to push saliva through his throat. So he swallows without any fluid, and he able to move and restore function. From that perspective, there is again no substitute for that, because only manual therapy allows you to greatly affect and restore function, and for those patients it is almost life-saving procedure, because the only solution, if it continue to deteriorate, which some of them happening in them, then the feeding tube need to be inserted. So to avoid all of that, with 3-4 sessions of medical massage therapy, we continue to see this patient on monthly basis for his lower back issues, for shoulder issues as a maintenance, and he never have swallowing problems since. And at this point, this case already almost 2 years old. I mean, his swallowing problem. Here is another case from our clinic. Patient suffered severe dysphagia after thyroid gland surgery, and you can see how scar restricts mobility. After releasing the scar tissue, her swallowing restored, and she was able to do it freely and without conscious efforts. So, what do you think about, or maybe you have experience to working on the patients with the swallowing disorders? And if you do, you can share with our readers and with us your expertise, and we can work together to help patients in the dire need. Thank you for watching, and let's work together to bring your practice to the new level of medical massage therapy. I hope you enjoyed this video, and you will see each other next time in the following videos. Thank you very much for watching.